You know that feeling, right? The weather changes, maybe the temperature drops or the humidity spikes, and suddenly you feel it right in your chest. It just gets a little harder to breathe. Well, today we are digging into that exact feeling, the incredible connection between the weather outside and the world inside our lungs. All right, let's get into it. Does this one hit home for you? That crisp, cold winter air? For some people, it's refreshing, but for you, it feels like an instant trigger. You know, this is one of the most common things people with sensitive airways say. Or hey, maybe it's the total opposite. Those heavy, soupy summer days where the air feels so thick you could practically swim through it. For so many, that mugginess translates directly into a feeling of breathlessness. And then there's this one. It's almost like having a sixth sense, isn't it? You can feel a storm rolling in, not by looking at the sky, but by a tightening in your own chest. It might sound like an old wives' tale, but it is a surprisingly real experience for a lot of people. So what is going on here? Are these just vague feelings, your mind playing tricks on you, or is there real, actual science happening inside our bodies when the weather shifts? Well, we're about to find out. Okay, so let's tackle that weather feeling head on. And I want to be perfectly clear. If you've ever felt this, you're not imagining it. This isn't just a story you tell yourself. It's a widespread clinical reality, and it's backed by some pretty mind-blowing data. Check out this number. A staggering 88%. That's right, 88 of people with asthma say that changes in the weather make their symptoms worse. That's almost 9 out of every 10 people. So yeah, that feeling is absolutely real. Now, let's get into the why. To really get what's happening, we've got to look inside our lungs, right down to the microscopic level. It turns out our airways have these super sophisticated, built-in systems that are constantly reacting to every single breath we take. We can actually break this all down into 4 key mechanisms. Think of them as the 4 main ways your lungs are having a conversation with the weather. Let's go through them one by one. First up, we have what I like to call the moisture shield. See, your airways are lined with this super thin layer of fluid that has to stay perfectly balanced. But when you breathe in cold, dry air, it's like a thief. It just steals that precious moisture and heat. And that disruption, it can directly trigger inflammation and cause the muscles in your airways to spasm. Next, your lungs have their very own alarm system. Your airways are literally packed with these tiny nerve endings. Think of them as little temperature sensors. When they detect a sudden drop in cold, they send out an alarm signal that can trigger a cough or cause your airways to tighten up. It's a pure reflex, just like yanking your hand away from a hot stove. The third thing that can happen is like a traffic jam, but in your airways. When it gets cold, the blood vessels lining your airways can actually swell up. This creates congestion, narrowing the path for air to get through. It's just like a highway going from 3 lanes down to 1 during rush hour. And finally, there's the inflammation switch. Research has shown that extreme temperatures can directly mess with the baseline level of inflammation in your lungs. It's like the weather itself reaches in and flips a switch, ramping up your body's inflammatory response and making your lungs way more reactive. Okay, so that's the how. We've got the science down, but how much does this really impact people in the real world? Let's take a look at the numbers, because honestly, they're pretty eye-opening. Let's start with the cold. Get this. A major review of studies found that being exposed to extreme cold is linked to a 20% higher risk of asthma attacks. A 1 in 5 increase tied directly to the temperature dropping. That's huge. And this chart just perfectly shows the seasonal effect. Just look at the difference in hospital admissions for kids with asthma. In July, it's down around 4.7%. But in September, it skyrockets to 12.2%. They call this the September epidemic, and it's a well-known phenomenon tied to that rocky seasonal transition when the weather gets all unstable. And it's not just asthma. For people with COPD, the effect is even more dramatic. The rate of flare-ups is more than 2 times higher in the winter compared to the summer. That is a massive, massive challenge for lung health during the cold season. So what about humidity? Well, it turns out it's not a one-way street. Too much humidity makes the air denser, so you have to work harder to breathe. But too little humidity is also a big problem. It dries out that critical moisture shield we talked about, which makes it harder for your lungs to clear stuff out. Your lungs really are like Goldilocks. They want it just right, not too wet and not too dry. All right, so if the science applies to everyone, Why doesn't everyone with asthma react the exact same way to a cold front? Well, this is where it gets really personal. The big picture data is clear, but your individual response is uniquely 100% your own. So you might have patient A. For this person, cold is the number one enemy. It's their most predictable trigger. They just know that when the temperature plummets, they have to be extra careful. But then you have patient B, who might be totally fine in the cold. For them, the trigger is the complete opposite, that hot, sticky, humid air. And this is a perfect illustration of how two people with the exact same diagnosis can have completely different weather triggers. So why the difference? Well, the reasons are pretty complex. It really boils down to this unique mix of factors. Things like your genetics, which control those little temperature sensors we talked about, how severe your condition is, your age, and even how used to your local climate you are. It's basically your own personal biological cocktail. So what do we do with all this? This is the most important part, right? Understanding that the weather affects you isn't about feeling powerless against it. It's about getting empowered to do something about it. And the strategies you can use are often really simple, like wearing a scarf over your mouth in the cold. That creates the little pocket of warm, moist air for you to breathe. Staying hydrated helps keep everything moving smoothly inside, or just keeping your indoor humidity in that sweet spot between 30 and 50%. These are small changes that directly fight back against those biological mechanisms we just talked about. So we'll end with this question. The science is totally clear. Your lungs are in a constant conversation with the atmosphere around you. The key isn't to control the weather, we can't do that. It's to understand your own personal patterns and learn to listen to the signals your body is sending you. So, what's your weather story?